I'm Dr. Steve Mahoney. We've had a lot of patients concerned with the COVID crisis about whether their skin rashes that they're developing are secondary to the virus itself or just to viruses we see this time of year. One of the things we've learned over the time with the research that COVID-19 is a biphasic disease where there's two phases. The first phase is seen by sore throat, fever, loss of taste, loss of smell, myalgias or muscle aches, and things that would be consistent with a fever. That can last anywhere between 2 to 5 days. Sometimes in many patients that's completely asymptomatic and they don't even know that they're even in this phase. They're just having some mild distress that they wouldn't even notice. That part sometimes is a prelude to the second phase, which is the more serious phase, which is the kind of the cytokine storm they've talked about, or this macrophage activation or cytokine activation where your immune response then becomes overwhelming and causes tissue damage, specifically in the lungs, the kidneys, and the liver, causing kind of a microvascular assault on your blood vessels in the kidneys and other places. Some of the things we've seen is that some of the skin findings can be kind of an omen or a harbinger of this coming. And so we're going to show you some pictures here that go over some of the findings that we've seen in patients that would be a warning sign. You can see in some of these pictures patients that have swollen digits, red, purple, on the tips of their fingers and on their toes. These are microvascular or little emboli that are going out to these blood vessels and blocking these small vessels and causing occlusions, and therefore redness, pain, and occlusion. The things that differ with these kind of rashes is that these are painful rashes. They're not itchy. They can be swollen and hot, but they're painful. Not many rashes, things like poison ivy and things like that, are not painful, they're itchy. So that's a good discriminating thing. The other thing is, do these rashes blanch? Which means if you have hives and you push on a hive with your finger, you'll see that the skin turns white around it. That means that those blood vessels are swollen, but they're not being damaged. And so you can push the blood out. When you let go, the blood comes back in. These lesions, and you can see some on the thighs, those are not blanchable. If you push your finger on it, those things stay red and they do not move. That's a sign. You can sometimes draw a little pencil or a pen around them and you can see whether or not they move at all. These should not move. This is a sign that there's actual damage to those blood vessels happening. And this is something that would separate you from just having an allergic reaction. The third thing, when these things are happening, if they are happening, that means that there's a vascular assault going on. Your body is reacting and making complexes that are attacking these things. And this is something that if you're seeing these kind of skin findings, you need to consult your dermatologist or your PCP and get tested, because this could be a sign that you're moving into that second phase where we see much more rapid hypoxia, shortness of breath, and things change very rapidly. And you don't want to waste time. That could be critical. So not every rash is something that's caused by COVID-19. We need to differentiate between which of the rashes we worry about and which ones we don't. If there's any question, please contact your dermatologist. We're available with telemedicine. I'm sure other patients or other offices are providing the same services where you can get these things looked at and at least said, this is something we wouldn't worry about, or this is something we need to take very seriously. So if there's questions, we're available, and we just want people to know we don't want you to be afraid of things that you don't need to be worried about, but we also want you to sit on things that could be very dangerous.